Late at night, you've finally had enough and decide to quit cold turkey. You throw the pack and the vaporizer right in the trash. But within 3 days, you find yourself at the convenience store counter, buying another one. You know the long-term health risks, but the immediate urge outweighs the future consequences. It is a frustrating cycle. You want to stop, and you understand the damage you are doing to your body, yet you feel unable to resist the pull when it returns. This pattern of quitting and relapsing follows a predictable path, one that suggests your struggle isn't a lack of character, but a physiological process you haven't been equipped to handle. Society often treats addiction as a moral failing, telling you that if you just had more discipline, you could finally kick the habit. But relying on willpower alone ignores the medical reality. Clinicians recognize this struggle as a specific diagnosis: tobacco use disorder, or TUD. TUD is a chronic condition driven by one of the most addictive substances on the planet. Nicotine alters your brain chemistry, creating a physical dependency that overrides your best intentions. If you are fighting a neurological disorder using nothing but discipline, you are bringing a tool that was never designed for a biological battle. Initially, nicotine provides a brief spike of pleasure, but very quickly your body adapts, eventually requiring the chemical just to function and feel normal. This graph tracks a user's internal baseline. As tolerance builds, your natural equilibrium curves downward. You now have to consume more nicotine just to bridge the gap and reach the steady line where everyone else starts. When you try to cut back, your system creates these brief spikes as it struggles to adjust. But because the biological demand is so high, the line crashes back down, making spontaneous recovery extremely difficult. Your reward system has physically adapted to the drug's presence. Once these changes take root, the body stops responding to resolve alone. When you stop intake, the physical withdrawal begins immediately. Focus becomes foggy, and an intense physical restlessness takes over. This is followed by a psychological crash. You experience sharp irritability and waves of anxiety that feel impossible to manage. Because of comorbidity, tobacco use disorder rarely exists in a vacuum. It frequently overlaps with underlying depression and anxiety. Quitting causes a sudden chemical drop that disrupts your mood, amplifying those existing conditions until they expand to consume your entire mental state. The simple urge to smoke has now escalated into a full-scale mental health crisis, which is why pure resolve usually shatters at this exact moment. Because the act of quitting triggers such an intense psychological crash, attempting to go it alone is a fight the user is statistically likely to lose. A condition that attacks both the body and the mind requires a coordinated medical and psychological response. The physical track involves using FDA-approved medications and nicotine replacement from a prescriber. This stabilizes your body and prevents the severe physical crash of withdrawal. While medication handles the body, a second pillar is required to support the mind. Behavioral therapy and motivational interviewing help you identify and manage the psychological cues that lead back to tobacco. Addressing the physical cravings while simultaneously building psychological resilience is the most effective way to end the cycle of relapse. For the psychological half of this treatment, Coping and Healing Counseling, or CHC, provides the specific support needed to navigate the transition. Their 100% HIPAA-compliant telehealth platform serves every county in Georgia. You can access expert care from your home, ensuring that your location is never a barrier to treatment. CHC's licensed therapists specialize in treating the anxiety and depression that often drive relapse. They also accept major insurance and Medicaid, which offers a $0 copay for sessions. Your past failures are not evidence of weakness. They are simply a sign you are fighting a biological battle without a clinical team. You deserve to have professional support in your corner. Visit chctherapy.com or call 404-832-0102 to speak with a therapist and finally take control of tobacco use disorder.